This is episode 15 of Soundproofist, and my name is Carrie.
And this is Phil.
Today we're going to talk with Arezoo Talebzadeh. She's an architect and a soundscape designer based in Toronto. Arezoo specializes in designing assisted living spaces and soundscapes for people with dementia. And we're going to talk about some of those special needs of people who have cognitive issues, particularly with sound. Arezoo is also working on a collaborative research project with a colleague at the University of Ghent, so we'll also cover that topic in this episode.
It was so interesting talking to Arezoo about her research, and I was especially excited to hear from an architect and how that they can incorporate acoustic-minded design into their work, especially in a healthcare setting where it is most needed.
I am an architect and I've been practicing architecture for years. And then at some point, I realized that when I went to architecture school, I was thinking that I want to be outside of the box because architects and design are usually not, at least they think that they are not in the box. And then at some point, I realized that I'm making another box around myself. It's a box of my clients, other architects, engineers, and I don't really realize what's going on outside that. So I was like, okay, I need to reimagine my life and what I want to do. So I said, okay, I'm going to go back to school and learn all the stuff that is new. So I went back and got a master in design for health. I wanted to do something for people, more human touch of the bringing to the design. So I went back and studied at OCAD University in Toronto. And my idea was that I'm going to go and work with the walkability in the cities and how can we make cities more usable for people who are aged a little bit or who have difficulties or on a wheelchair, maybe how we can make the city work for them. But when I was in the school, we had a project that we had to do at Toronto Rehab Center for the people with dementia. So when I went to do the literature review for the people with dementia, I figured out that, perception is something completely different if someone has dementia. So for architects, we always think that when we design a space, people have the same perception of a space as we intended to design. It's something that we usually don't think that people may have completely different perception of a space, especially when it comes to other stimuli, not just the vision, it's sound or smell. So I was reading about the dementia and how the perception of a space, especially the audio perception and the sonic environment, has changed for the people with different type of dementia because they cannot make that relation that everyone else make between the source of the sound, and that's very confused them. And that's one of the reasons that they get lost or they cannot understand the time of the day because sound doesn't have the same meaning for them. So that was very interesting, and I get more into it. And at the time, I was working on the sound on that unit, and one of my cohorts, she was working at the light. So we working in those together. And then I thought that maybe I continue on it and make it my final thesis for that program. So then I start to learn about the soundscape. And at the time, I thought that, okay, soundscape is like landscape, right, for architects. So I'm just going to do a sound map of the unit. And everyone was like, yeah, that's fine. Come and do it for our unit. And then I went into more literature and learning about the soundscape. And then I figured out that, that is really something more than just the sound map. So I was very interested to know that the soundscape looks at, I'm pretty sure you know the meaning of soundscape because everyone talks about it. It's about how people perceive sonic environment. It goes back to the individual perception of the sound in any context. So it's not just about me who are from the outside designing for these people, but it's about how people who are in the space perceive the sound. And that's the basic of soundscape design and soundscape approach. So it was very interesting because it's exactly goes back to how I feel about the architecture and how we have to, when we're designing a space, we need to look at those who want to go back and use those space. And that's get me very interested in the whole idea. I started doing some research about it and I became soundscape researcher beside my own architecture background. So now I'm trying to put them together on how we can help people to enjoy the places that we design for them. And in some cases, especially for the people with dementia, that's my research right now, is how we can help them through the soundscape of the space that we are designed so they can be less agitated, or we can help them to navigate through the day just giving them some signal of the time of the day through the soundscape. So that's how I got into the whole researching soundscape researcher.
Can you give an example of how, for example, a person with dementia would, through the soundscape of a space, understand the time of the day?
So this is actually what my next phase of the research that I'm doing is going to be about. And I'm just going to say that this is not something that I'm only doing it. I'm doing it with a researcher from the University of Ghent in Belgium. So they started to do the same idea for years. They are working with people with dementia in senior housing. And they, through the co-design with the nurses who work with these people with dementia, their caregivers, and all the psychologists who work with these people, they came up with this idea that if you design a soundscape, that it can give you a little, as I said, that little clue of the time of the day. For example, in the morning, if there is a sound that tell you that it is the morning, it's like kettle is boiling, or it's just a bird singing at the background. It gives the people with dementia the idea that, oh, this is the morning, this is a sound that I am very familiar. And the whole point is that this soundscape design has to be very individual, based on the individual perception. So I cannot design one soundscape that works with everyone. Of course, everyone has a different background, different culture. It depends on where you grow up. If you grow up in the rural area or in the cities, the whole life that you had a different soundscape background. So that's something that we always have to do in the beginning. So we have to go through the questionnaire, ask either the people has dementia, if it's not too advanced, or the caregiver or people who work or family members, to have a background of the culture of the person and the place that they live, the type of activity that they used to do, if they are in the sport or not, if they are like active people or passive people during their life. And then we put this soundscape and design it to the way that from the morning, we put the different sound of the day, like, as I said, like birds singing in the morning. And then it goes to some time in the day, maybe the church bell. It depends if that person is a person who used to go to the church, that can help. Or if it goes to the end of the day and we want to make them ready to go to bed, then we can put a sound that is more relaxing. If they used to listen to music can be very helpful. I know Phil probably has more idea about the music part. Just help them to calm down and get ready for bed. And then there is an idea that even during when they sleep, we can use the like heartbeat maybe. I'm not sure about that part. We have to test it. If heartbeat can help them to have the more relaxing time to sleep, because we know that sound during the sleep affects the people and then it get them agitated. Even if you think that you're asleep and you're not listening to anything, because our ears are always on and there's no lead for it, so you can hear it. This is something that we say in the cities when we live beside the highways. Even if we are asleep, the sound of the highways and the noise is gonna bring our heartbeat up and give us kind of a agitation and anxiety even when you're asleep. So we try to bring it back to the soundscape, and that is more calm during the sleep, and help them to, in a nutshell, to improve the quality of life for these people with dementia.
So does this include sort of having sound that is playing inside of the rooms and inside of the unit? So you're controlling kind of the soundscape of the space that they live in so that it's not randomized anymore. What about during the day? Not just when they're sleeping or waking up, but what's happening throughout the day? And again, you say it's personalized, but I'm curious to know what some of those solutions are.
So there is actually when you work with the soundscape, there is two things that we can do. We can reduce the noise that is agitating for the people by stuff that architects do and acoustic engineers help to do. So putting the sound masking, for example, or change the STC of the wall. So we make sure that the unit has, or the room or the living room of senior housing, it doesn't bring all the sound of the HVAC or air conditioning in to disturb the people. This is one way. The way that we are doing it with the soundscape, that we are adding a positive sound to the space, to the sonic environment. And it can happen along the way in the living room. For example, the The study that now I'm part of it, in the beginning, they did it in the living room of the senior housing when they add some other noise to give them a clue of, is this the lunchtime coming? So now you can hear the sound of poultry, for example, or dishes happening. So people get ready for the meal. And then, so it can happen all around the unit. In my study that I'm doing in Toronto Rehab, we're just going to just focus on the rooms that this individual are in, because we want to do the clinical trial. We want to get the data that is more, it's not descriptive kind of a research. It's more like we want to be more precise, so we can really use our data to have a kind of a clinical trial research as evidence-based design for our theory. So we are doing it just in the bedroom, but of course you can do it all around the unit. And if it works, and if we can find a way that we go forward with it, then we can do it. You can just get this device, install it in your home if you have a problem with dementia, or you have someone, your loved one have a dementia. So you can put it in your home and just design it to the way that it plays the soundscape that individual prefer, and helps them to sleep better, or if they are very agitated, it can help them to lower their agitation. Because one of the things that in dementia, it's called BPSD, which is the behavioral and psychological symptom of dementia, is something that 80% of people who have dementia go through this, that they get very agitated or anxious, and this number goes up. And one of the things that we always, I mean, not me, I'm not a clinical, but in the healthcare, they always try to do to lower these BPSD numbers. And we think that this soundscape can help to lower that BPSD numbers and help the people. So yes, just answer your question. It's going to be an extra sound that we are adding to the sonic environment.
How is the BPSD? This is probably outside of your wheelhouse, but do you know how the BPSD is measured? The level of agitation?
There is a different chart, let's just call it, like that geriatric psychiatrists, they know how to deal with it. And I have it in my research, but this is not the part that I'm very familiar with it. So it's a different type of methods for nurses go to the room, they witness what's happening for that patient, and then they fill a chart, and that chart is going to get used to evaluate the BPSD. So it's for their agitation, for anxiety, even for heartbeat, for the way that they sleep. It's a different aspect, and there is a long list of it that they always use it in the unit that I'm doing my research. That's one of the purpose of this unit, that people with dementia who are very agitated and they have a BPSD, a number of the very high number, they come to this unit, they stay 6 weeks in that unit, and not through the drugs, but through they're not doing environmental change in their life. They're more like through the OTs or occupational therapists or all this stuff that's happening in the unit, they lower the BPSD. So now we want to think about the environmental aspect that we can use to help the people to lower their BPSD.
And in these facilities where the dementia patients are housed, are there existing acoustic standards from an architecture standpoint for these healthcare facilities? Does Toronto have specific guidelines for these things?
In Canada, we don't have a specific guideline for people with dementia. There is some exist in the UK and probably in the US. I know that AIA has some recommendation. We just follow the healthcare recommendation when we're designing this unit. So that's one of the things that probably is going to come very soon, that we can just design it specifically for the people with dementia and how the environment can help.
And when you were starting this investigation, how did you measure the acoustic environment or get a sense for the auditory environment of the ward?
So in the Soundscape research, you do a measurement of the sonic environment, the dBA, the loudness, and everything. And then at the time, because I wasn't too much familiar with the Soundscape research, I did it through the sound measurement. So I would go to the unit, I do the sound measure for the dBA and the loudness, and then I would do the other part, that it's a more subjective part of the Soundscape research, as just my own view of the people around it. So I was looking at that timeline. Are the people are agitated? Are they feel anxious? Are they happy or sad? And then I would relate, the whole idea was that we can relate them together and see if the level of the sound in that unit in that time has anything to do with how people respond to the sound, which I realized at the time that it's very subjective, because it was a time that the sound level of the unit would be very high. Because, for example, there was a time for the music and everyone played music. And it was so agitating for me as a researcher to sit there and do it. But when I was looking around, I see that people are really happy. So people with dementia were really happy and they were like really enjoying their time. And then I realized that perception is really important. So it's me looking at it with the people who are there and enjoying is really different. And then when I did more research and I went to the next phase, I realized that we need to do the binaural measurement when we do the measurement of sound in this level. So it's not just about how it has to be really the way that the head of the human being hear the sound level of the space. So that's the one that we do. But in the research that I'm doing, we are not going to measure the level of the sound in this unit. So yes, of course, there's going to be some noise that's going to be always in the room. Like they have the air conditioning unit. It is a hospital unit that I'm working on. So there's going to be lots of buzz happening during the day because of the alarm going off. We understand that, but and we know that if you really want to do something for the environment of these units, we need to figure out that part too. I mean, these alarms should not go off all the time. It can just be through vibration through the nurses. And there's lots of research on that, or how we can lower the sound of the HVAC in these units and how we can make a better STC for the valves, for example, so the sound won't go from one room to the other one.
It didn't occur to me that there might be alarms and things going off in a dementia ward. It seems like that would be, it's hard for anybody to listen to, and certainly for someone who's anxious, that would be extremely difficult.
Yeah, they always have the alarm, especially because some of them have to, because of the specific requirements, they have to be always seated on their wheelchairs. And these are the kind of wheelchairs that if they try to get up, the alarm goes off. So you can always hear all of these alarms going off. That's one of the things that you need to realize when you're designing for the sonic environment.
I'm curious about that. With your background as an architect, is there any reference? I guess the question is, the soundscape has so much of a temporal aspect to it. It changes over time. And I'm curious, as an architect, is that something that is traditionally considered when designing a facility, that how the facility will be at different times of the day or the season?
It's interesting that you said that. I was recently listening to another podcast about the sound and noise. And the guy was talking about that, how people go and ask architect to design a space, and they want to know how does it going to look like, but they never ask that how it's going to sound. So I think it's just because the sound is something that we don't see it that much. So people don't think about it. We know that if we design a building close to highway, it's going to be noisy, or the rail, it's going to be noisy. But we never try to tell them or represent how it's going to sound in the future. So it's not something that our architects design. Usually we bring the acoustic engineers to help us to make sure that everything's just vibration works and we don't hear the voice of the elevators going up and down, or is a garbage chute very close, how we can just make sure that the noise is not going to come into the unit. And then it goes to all the hospitals, is more like they have more something to say, acoustic engineers. But architects traditionally don't design for the better sonic environment or look at it. But it's something that is coming to play somehow. And that's something that I hope that I can bring into the architecture design for a client, for example. Not only we show them the visual, or we usually walk them through the space. It's easy right now. You just give them the headset and they can walk through the space. But now we can add the sound to it, and we show them how it's going to sound in different time of the day, or what they want to hear during different time or different rooms. Do they want to hear the sound of outside coming in or not, for example? And that can be very helpful. Especially one of the things that I'm working in an office in Toronto called Kasian Architecture. And we do healthcare, we do senior housing, we do educational and workplaces. And one of the things that recently we started to work on is a workplace for people with autism. So when you design a place for people with special needs, you need to be careful about how the space looks like, even the color that you use, but also the soundscape of that space, especially when the people, for example, people with autism, they can be hypertension or they can be in the other side of the spectrum. So you have to give them this choice that if they want to work in this space, they can choose the sonic environment. Do they want it to be loud and noisy, or do they really need it to be very quiet so they can focus and work? And same things when we design a workplace for the people with dementia, because the sonic environment really affects their life. If we can make this space somehow that they can control the sonic environment and they can make it really quiet if they need to, and so they can work better, so we can give them more opportunity to work for a longer time, even when they're diagnosed with the dementia. And that's the whole idea of the inclusive design too. So every individual has a say when they want to go in a space. So it goes back to their perception of the space, the kind of when we have a disease and their difficulties, the cognitive difficulties, this is not something that people see. And you can just say that, okay, I want to design a building that is wheelchair accessible. It's easier for people to understand and see it. When it comes to something that is cognitively related to people, you have to, architect and designer, this is our responsibility to tell our client that someone may have a problem with the sonic environment, and we have to design it for their needs. I don't know if I answered your question.
No, that's really interesting. And it makes me think, especially what you were saying earlier about an individual's perception and background is very important in the way that they perceive the sonic environment. So I guess that leads me to the question of, when you're designing these things, or specifically in the dementia ward, do the patients themselves have some control over, like the example of when you said they were all playing music and that made them happy, that they had some control? Is there some way that in the design you can give an individual control over the environment in a certain way?
In some places, yes. In the traditional way of the designing place for people with dementia or Alzheimer, or usually it's just design as it is, and there is no way that you can change it or someone can go change it. But now with all the idea of that spaces has to be individualized, so many researchers and designers looking at how we can make a place so everyone can choose what they like, even it's a color of the room or the texture. The texture is very important for people with dementia and autism too. So if we can give them the texture that they want, and then how we can educate the designer and the client, all the stakeholders basically, that sonic environment is as important as everything else. And then maybe they can give them this option in the near future that they can even choose the sonic environment that they want, if they want it to be really quiet or not, if they want it to have a background music or not, or if we can use this, the one that I'm using in my research, if we can give them the clue of the time of the day and the space and can help them. So now at the time, it's not really happening, but it's something that everyone is talking about it, they're trying to design around it. So in the future, it comes to play.
I would think that some needs of some people with dementia would be also different if they have hearing impairment versus sensitivity to certain noises, because I've read that in some cases, dementia can be a result of living with hearing impairment for a long time, because you have a certain amount of cognitive decline when you can't hear very well. So I would imagine that some of these environments, you probably have to design for people who can't hear very well versus those who need to block sound, certain types of sounds. Is that true?
That's true. Hearing impairment is one big thing in dementia, and it plays a big role in dementia. So that's another thing, that if we think the place is loud, or if how the person who has this dementia, how that person feels. So, and that goes back to the idea of you have to go and talk to the people who are using the space and get their perception idea, and then look at that. And it may sound a little unusual and not doable, because then you think that, okay, I'm going to design this senior housing with a level for the people with dementia. And so the people are going to come and go and they're going to change. So how can I design that the design change with the people who come and go? In the architecture part of it, we play with drywalls. I mean, how can I change that drywall all the time? It's not going to happen. And that's true. But then something like the soundscape can play a really big role, because that's something that we can change. You install the player in the room, and then you can just design the soundscape all the time based on the data of the person who's going to use that room or that unit or that space. And that sounds more doable.
I remember, this was a few years ago, some study or some group that had created iPods with playlists specifically for people with dementia from the time period of their lives when they were young, music that they might enjoy that would possibly trigger memories and make them feel comfortable. Have you ever heard of doing anything like that?
I actually thought of doing it for myself because I was being involved with people with dementia, and I always think that I may be one of them in the future. I always think that I have to put a playlist for my future if someone in the future has to deal with me or be my caregiver, so they know that what type of music I love, so they can play it, because music has a big role. My research is not in that part, but there is so many research on the music for the people with dementia, and it's, of course, as you said, it goes back to their culture and their background, and usually goes to the young, when they are young, what kind of music they used to listen, and it brings the memory. And the whole things about the dementia is that the memory plays the most important role, especially in Alzheimer, for example. With music, you can bring the memory, and it's so helpful. But as you said, there should be a way that you have a playlist so you can go and play. And then I'm working in Toronto. Toronto is a very diverse city, and so many of the people who come to these units or to senior housing, they have a completely different background. They don't even speak English anymore, because when you get the dementia, there is a good chance that you stop speaking English and you go back to your native language. So how can we communicate with them and get this out so we can design a better soundscape, for example, for them? So that's very interesting that you said. I didn't know about that research, but I go and see how probably they advance now.
Well, because it was on iPod, so I'm thinking it was probably the mid-2000s. If I can find the information, I'll send it to you. I thought it was really interesting, though, because it did seem like it had a really soothing effect and a helpful effect on behaviors of people with sort of advanced dementia who were, wheelchair bound, and it calmed them down to be able to hear, maybe big band music or whatever was, important to them. And each one was kind of customized. I think it's a great idea. Actually, I want somebody to do my soundscape for me. The soundscape for when you're trying to get work done, but there's construction going on outside, that sort of thing. You said, a few months ago when we first began talking about doing this interview, you were about to begin a research project. I believe it's the one you were referring to with Ghent, University of Ghent. That is underway now, is that right? Or you're still going to begin that project in the future? I know we got interrupted by the pandemic.
Yeah, pandemic is just slowed down everything a little bit, but it's underway. We have to get the research ethic approval, because we are doing it, of course, with the people with dementia and in the hospital setting. So getting that REB approval, we have to tell the people that exactly what we want to do. So it took a little while, because this is the research that's happening between, as you said, University of Ghent, with engineers from them, and from Toronto Rehabilitation Institute, all the healthcare providers. And then I am just an architect in the middle and trying to get them all together so we can all understand each other. That's always very interesting and challenging for any research when it's multidisciplinary, because people have to get to the point that they all have the same say and same language. So it took a little while for us to get to the point that we all understand what we want to do, and then we put this RAB into place. So now it goes to the long time of reviewing the RAB to make sure that what we do is not really going to harm anyone during this research, which is very important. So it's still going on. We are still in the starting phase, but hopefully in the couple of years, we're going to have the data, and then we can talk about the results.
I just had another thought about the creating playlists sort of soundscape. And you mentioned the multicultural aspects of living in Toronto. I wonder if there's a way you could sort of have a citizen science project where people would contribute their knowledge of soundscapes from their homelands to help people who have dementia, who probably can't tell you anymore what it is that's, important to them from their culture that they want to hear.
That's a very interesting idea, actually. I like it, because you're right, because people are the best resource that you can go and ask, and if we can put them all together. So if someone's coming from Middle East, just completely different background during their life, and then it can put them all together and they can go and use them. I am a big fan of citizen science. Yeah, that's a good idea. Maybe someone just hear it and just go ahead and do it.
Yeah, I know it'd be fun to participate in. I mean, I know sometimes it's not just music, but also like the sounds of the street, the marketplace, just sounds that we might not think of, that we can't guess what that might be for them. I think that would be a really cool project also.
When we were talking about my project with the University of Ghent in Belgium, the whole idea was that, okay, we want to use the sound of birds, but always going to be all the same birds. If the European birds sound the same as Canadian birds. So that was a very interesting topic that we went through, and I still don't know. We're just going to give it a try and use the bird sound that we think that everywhere sounds the same. But I mean, when we talk about the soundscape, it's just not one answer. It's just there are lots of things that come into play. And then all of these, even if you do the perfect soundscape design for one person, sound is not the only things that are going to affect their life, because it's still going to be in the room. There's going to be a light. There's going to be a smell has a big deal in it. So it's not just one thing that's going to happen. So they all have to come together, but we all have to do a little bit of it and help into the whole process.
That makes me think that I should plug the Macaulay Library and the Cornell Lab of Ornithology. They have a huge online database of bird recordings from all over the world, and you can look for specific regions and get recordings of birds from certain geolocations. They have a massive library.
That's very interesting.
I can send you links to that as well.
I appreciate that. Yes. So they are not all sound the same, right?
Definitely not. Definitely not. Actually, there was an interesting article that in Canada that some bird song was traveling from Western Canada to Eastern Canada. And they were tracking it over 10 years that these bird songs were changing. It's very preliminary research. So the journalist is always the one trying to make it a sensational finding. And the scientists are always the ones that are like, we don't know. Like, calm down. Maybe this has been happening always. But anyways, definitely the songs are different. I mean, we were talking with Dan Duggan, and he was talking about the variation in bird songs in different neighborhoods of San Francisco, and how some areas, the same species of birds will have different songs. So I think there's quite a bit of variety.
That's why it's good really to talk about this research. Some people don't like to talk about their research when it's in the beginning, because as you said, they said that, oh, we don't know, we may not have the good data. But I think that when we talk, we learn through the process. And I think that this is a process that we all have to go through, and everything that we learn is going to help. So I appreciate your talk.
You also do some work, don't you, with Hush City and the Hush City app?
Yes, with Dr. Radicki, Antonella. Well, I wish I could work more. I am using the app that they have, the Hush City app in Toronto, but I live in downtown Toronto, and finding a quiet space. I mean, it doesn't have to be a quiet space in the case of Hush City app, but really, like, I don't want to record the sounds of traffic in Toronto for someone to go and look at it. But every time I find a place that is quiet and it makes me happy or makes me calm, I try to do my part as a citizen scientist and put it in the app. So everyone who is looking for it in Toronto, they can go and find it. And it's very interesting. Once in a while, when someone else puts something there, I go and listen to it. And it's very interesting to see what's going on around the world.
It is. I do it also for San Francisco. I don't always remember when I find a quiet space to pull out my phone and do that. But I have, not very many people are doing it here, but at least they're being recorded. And especially during COVID, there were a lot more quiet spaces than normal. And I tried to capture a few.
For a while, it was very quiet.
Yeah, for a while it was. Not anymore. No, it's all starting up again. In fact, I was wondering also if some of the learnings from, a lot of the outbreaks, especially the earlier outbreaks of COVID-19, were happening in assisted living facilities. And I'm wondering if some of that learning has informed you of going forward about design for assisted living facilities.
Yeah, unfortunately, Canada hit very hard in the senior living sector with the COVID-19, and it was so sad. And as a designer and architect, what we want to do, we want to just put all of these in the better design for the future. And mostly it goes with the infection disease and how we can stop it, because that played a big role, how we design the spaces and how people come in and go and then bring the virus in. But now that we are looking at the guidelines and how we can go forward, especially because Canadian government wants to really do something about it. So we are all so sad about it, and we know that we have to do something. So that's something that it's going forward. And of course, when we start to design them for a better future, we cannot just look at one aspect, say that, okay, infection is important, because of course the next time maybe something else come and hit us. So we have to be prepared. So we are looking at the sound, not only the sound, it's just more like all the aspect of the environment, light and the noise, and then the HVAC system, for example, how we can make something better for them. And we're looking at it, but it's just, we are so much into it right now and everyone's talking about it that we have to like step back and look at what happened and why it happened. And then hopefully in the future, we can do much, much better for the people living in the senior housing.
I'm curious, I was looking through some of your publications and it seemed like you were doing some research with exergaming. Can you tell us what that is or about that research at all?
I used to do it. I had to stop it because I couldn't just do all of my interest in research and my everyday job, which is an architect. But I did some, because I was working in a senior population, we had an opportunity to work in a research group with some of the people who are in the healthcare and who are much more familiar with the people who are older age. And we are trying to find a way to make them to be more active, especially when they live in the senior housing and they don't have that much ability to, for example, go out because of their problems or the way that that house is just regulated. So we were trying to come up with an idea of the exercise for them to be more than just playing the V, for example, with the computer, something that is a little more doing the exercise and make them happy. So we came up with the idea of them making them like a bingo, but we put it on the floor so they have to walk and play the bingo. And we did a very prototype of it and we tested in a couple of senior housing room in Toronto, and we got the data and everyone was so excited. Our prototype was just very simple at the time. We didn't even have a game into it. We just had to explain it to people to play, but they would go and play. And I think it's just something that my whole research is just about the people who are age and they are senior living and they really want to do so much more, but sometimes they live in places that they don't let them to do it, not because they don't want them to do it, it's just that they don't have the facilities to help them, to support them. So this was one of the things that we said, how we can bring some excitement to the exercise so people can, as a play or a game, so do some exercise and not just to put the headset and virtual reality on it. So make it more tangible, especially because the population that we have in Canada right now as senior, they didn't grow up with virtual reality, right? They want everything to be tangible. So if you can walk on something and then play with that and it just turn on and off or make a sound and play sounds, that can be more exciting. So, but I had to leave that research because I really wanted to focus on the soundscape. But it's nice that you find it. It was a very interesting research at the time.
It's interesting because I wonder if some of that would also work for dementia patients, getting their bodies involved in a game, or are the people that you work with more advanced than that? Wheelchair bound. Even in a wheelchair, though, you might be able to play a game.
The people that I'm involved in, they're very advanced, but not all of them on a wheelchair. And some of them actually are too active and they walk around the whole day. And actually the soundscape can help them to calm down and sit down, because sometimes really you need to force them to sit sometimes because they walk all day around the units. But of course, exercise is one of the things that for people with dementia is as important as everyone else. So if anything that we can do to make them to enjoy when they do the exercise. And there is some researchers who work especially on the exercise for people with dementia, and there is some way to do it. And we are not, in my research, we are not looking at the daytime for the people with dementia and the soundscape, but I'm pretty sure that soundscape can help people to get excited and start to dancing, because people with dementia, I mean, like anyone else, they love to dance. I mean, everyone loves to dance, and you just need to put the right music in or make them excited. So that's something that definitely we need to look at.
Thanks so much for sharing your research with us and talking with us. It's so interesting.
Thank you too so much. I really enjoy your podcast, by the way.
Thank you. And I like yours. Actually, we didn't even talk about your podcast, but that was interesting because you have interesting topics, but it sounds like other people sometimes do some of the interviews. But it's a wide range of topics. Yeah.
That's more like inclusive design. And then I don't interview them. You always bring two persons to talk to each other. So it's a conversation, not interview. And that's the base of the podcast.
And thank you so much for your time and taking off your Saturday afternoon for us.
Oh, thank you. It was very enjoyable talking, both of you, actually.
I'd like to thank Arezoo for joining us today on Soundproofist and for sharing her ideas and insights on soundscapes for special needs. As always, we'll put some notes on the Soundproofist blog with links for more information. Thanks for listening. And remember to stay safe and be kind to each other. See you next time.